Voyage, Birth, Thriving in Labor e-course. My name is Katie, and I'm hoping that today we can have some fun and learn some things about how you might cope with your labor that's upcoming. First, I'll tell you a little bit about me. I am a mother of 3, so I've been through this process 3 times. I'm a birth worker, so I'm a doula and childbirth educator, placenta encapsulator, postpartum doula, and I've been doing this work for over 6 years since my first child was born, and I became really drawn to this world of birth, of pregnancy, of becoming a family, and of supporting families as they are bringing their new babies into the world. I get very excited about helping people come to the belief that they can have a very positive and transformative birth experience, and I hope that you will come to that belief today in a small way. The goal of this workshop today is at the end of our time together, you'll have some tools to not just survive your labor, but actually to thrive in your labor and even have a little bit of fun. And I want you to know that I don't care actually if you plan to have an epidural as soon as you get to the hospital, or if you are hoping to birth on a slip inside in your backyard with a unicorn. It really doesn't matter to me. I believe that all birthing people need skills to calm themselves, to focus, to diminish their pain, and to support the flow of labor. So that's my goal for you today. At the end of this video, I'll post some links to everything that I cite. I'm going to be climbing on the backs of some great people in the birth world and citing them. So I'll give you some links to those and some helpful resources. Also, I will have a handout on our website, which is www.voyage, V-O-Y-A-G-E, birth.com, and that you'll be able to download there. That will have a list of all these techniques and some tools for you. So now I'm going to give you a list of the things that you need to be able to complete today's course. As soon as you hear the things that you need, then go ahead and pause and go gather those things and start up again when you get back. So at the very end today, you're actually going to need some ice cubes. So if you don't have any ice going in your freezer, start it now, and hopefully by the end it'll be a little bit cold. So you'll need some ice, maybe 2 or 3 cubes per person. A bowl and a towel for a little exercise we'll do at the end. If you are on carpet, that's great. If you're not, then go ahead and grab a yoga mat or a soft blanket, a towel, something that will help you to be able to get down on the floor on your knees and not be in pain. If you have a yoga ball, or it's also called a birth ball or a physio ball, go ahead and grab that as well. That will be a helpful tool for us today. If you don't have one, that's fine. You can still use a chair or the edge of the couch or something like that to lean on, and you just may want to consider ordering a ball before your birthing time comes. You'll need some sort of sturdy chair to use both for leaning against and for a supported squat activity we'll be doing. Please be wearing something comfortable. You're hopefully in your home, so you're wearing your pajamas or some leggings already. But go ahead and change clothes if you need to. And then, of course, if your birthing partner is available or somebody who you can practice with today, go ahead and grab that person as well. And hopefully they are taking this course with you as well, so that you can have some tools together to be able to cope with your labor. So a little overview of our course today. I'm going to be offering you some very basic ideas about labor and about coping in labor. I'll give you some basic technique. Starting that section again. So a little overview of today. Before we start, I want to give you an overview of what we'll be covering today. So I'm going to talk with you for a little bit about some very basic ideas about what labor is, what our bodies do in birth, just so you have a context for some of the things we'll be practicing today. I'm going to talk with you just a little bit about what it looks like to cope in labor, pain versus suffering, some things like that. And we'll be also talking about just the basics of positioning and how we can use movement and gravity in labor. Then we'll be practicing a lot of comfort measures, techniques, positions, and talking through those as well. And partners, as we go through those techniques, I'm going to be sharing with you how you may use your body and your hands to support her in labor as she's going, and hopefully you come out of this feeling very supported as well, and how you can be a very active presence in the birth room. We'll also talk a little bit about what it looks like to support a birth with an epidural, what it looks like to support a birth with a lot of back pain or back labor. Those require some different things. We'll talk a little bit about pushing in the birthing stage and how that changes a little bit. And at the very end, we'll actually do some practice. So we're gonna do an ice activity, which I'll talk about when we get there, and then we'll actually do a little bit of a labor rehearsal. I'll give you an opportunity to put some things into practice and to just put it all together at the very end and send you on your way. So that's what we're doing today. Let's go ahead and get started. So I'm going to be honest with you. I'm not going to sit here and tell you that labor is not hard. I'm not going to tell you that it can be painless. I believe that for some people, they could have a very unique experience and have labor be not very painful, but for the most of us, it's going to be difficult. It's going to be labor. It's going to be one of the hardest things you've ever done. Personally, I've climbed mountains and I've run marathons, and my labor experiences, all three of them, tested me in similar ways, bringing me deep into the labyrinth, this winding path, to gather what I needed to get through and allowing me to weave my way out again. My labors changed me, and yours will change you. But just because it's hard or even painful doesn't mean that you have to suffer. You can cope with the pain, you can find the endurance, and you can deal with the unexpected. The greatest work that we do in labor is actually learning to go with the sensations, to relax through them, and to let our body do its good work. It's not the same kind of pain as anything else you've experienced in your life. I promise, it hurts, but it's not hurting you. There's an acronym that we use a lot, and I'll put it up on your screen here. It's PAIN, which stands for pain, but to talk about the difficulty of labor, we use these 4 words. P stands for purposeful. We know that the work that you're doing in labor is bringing your baby or babies into the world, so it's a really good thing. The A stands for anticipated. We know that in some way you're going to be going through this path where your uterus will be contracting, your body will be opening, your baby coming down and out into the world. So we know this is something that you can handle and that your body will be doing. We also know that we can anticipate the next wave or the next sensation. So you finish one and another comes. We'll talk about that more in a little bit. The I stands for intermittent. So you get a break. You have a contraction and then you have a pause. And the further into labor you go, the longer the contractions and the stronger and the closer together they are, but you still get a little bit of a break. So we'll talk about how to use that break and also mentally how to cope with the repetitiveness of labor. And the N stands for normal. It's not something that means that your body is being injured. It's actually just a normal process that your body knows how to go through. So PAIN. I hope that's helpful to you. One other thing, I want to make sure you know that I know each person taking this course will have a wildly different labor from the next person, and I don't pretend to know what is in store for you in your labor and your birth experience. You may want to think about things that help you personally cope with stress, with sickness, or with pain in your life. For instance, if you really like baths or showers, if you're somebody who really likes to get into water, you may want to figure out a way to have access to water during your labor, either being in the shower or the bathtub at home, or potentially having a tub available in your birthing place for you to be able to labor in or even birth in if that's an option available to you. If you're somebody who needs to be in a dark, quiet place, if you come home from work with a headache and just need to crawl into bed by yourself, anticipate that might be something you need as well. Perhaps you will be somebody who doesn't need to be surrounded by people. Maybe you primarily need to be left on your own to just cope, and that's okay too. You may find that you need a cave-like atmosphere in labor, and we'll talk about some strategies for achieving that, even in a busy hospital. If you're somebody who likes distractions and humor, you may want to make sure that you have your favorite TV show available, or make sure your partner has some jokes on hand that they can tell you. And I promise you will know when those things aren't serving you anymore. If you start to feel like you're going to snap at the person telling you jokes, it's probably time to turn to some other options for coping. Lastly, if you're a food person, I know I am, if you just want to eat your way through your emotions and your pain, then you're probably going to want a lot of snacks on hand. So it's actually something that is not contraindicated in labor. There's really good evidence out there for eating all the way through your labor, as long as you are hungry and you feel like it. If you think about any endurance sports that people do, people running marathons or climbing mountains or running or swimming long distances, they don't do it on an empty stomach. They have strategic, high-calorie, powerful snacks that get them through, and labor is a similarly high-endurance physical activity, and you need to nourish your body to get it through, to give it energy. If your endurance and your energy are really wagging in labor, that's not the right word, lagging, that might be it. In labor, it's probably a good time to have a little bit of a snack. Another thing to think about is labor intensifies as it goes, and things get longer, stronger, and closer together. And what works for you in the earliest parts of your labor will probably not be the thing that works for you later on in labor. Expect to need to adapt as your labor progresses, to be able to try a bunch of things, leave room for creativity and intuition, and to see what helps you particularly. When I'm talking about techniques that we're going to try today, I'll also try to identify for you which techniques will be helpful at particular times in your labor. All right. Some real basic things about labor and what it is. So labor is the process by which babies come into the world. That might be very basic, but we're starting with the basics. Essentially, your uterus, which is that home, the organ that is housing your baby right now, is a big muscle. And when labor approaches, that muscle is prepared to tighten and to strengthen, to build muscle fibers, especially at the top, to bring baby down and to open that bottom, that cervix, the opening of the uterus, to accommodate baby coming through all the way out through the vagina. This is a labor coping class, so we're going to say vagina. Just deal with it. Contractions are that tightening, and they come and go. So you've got a contraction where your uterus tightens and then it lets go. And in the beginning of your labor, those contractions or those waves are going to be farther apart and more mild, maybe feeling a little bit more like cramps. And as you go, as things progress and get closer to that fully open time where your baby will actually be descending through the pelvis and out, they get longer, stronger, and closer together. You know that your labor is progressing when your contractions feel longer, stronger, and you've measured that they're closer together. When your cervix is all the way open, the contractions will start to change a little bit. You'll start to feel more pressure in your pelvis and in your perineum and in all the muscle and tissues down there. You may start to feel like you have this urge to push, this urge to bear down. And then you may feel that involuntarily your abdominal muscles and your pelvic floor muscles start to work together to bring your baby down. It's as involuntary as the vomiting reflex or what you feel like when you need to use the bathroom. And that's called pushing. So you do that, and once baby is out, your body has a few more contractions to bring out the placenta, and then you're done, except for mild contractions that help bring that uterus, which has stretched to its maximum, back down to its normal size, about the size of your fist, way down in your pelvis, which is called involution, and you'll maybe feel some mild cramps as that's happening in the first few days and weeks postpartum. That's labor. Our bodies are incredibly amazing and wise and made to do this, and I hope you'll recognize that today. All right, we'll talk about some coping tools now. So most of the coping tools out there that people use have to do with one or more of three things, and these three things all start with R. This is a concept that Penny Simkin, who is a great in the world of birth, she literally wrote the book. These are ideas she put forth a long time ago, so I'm just going to borrow them today. Number one is rhythm. So when we see people giving birth who are coping well, they almost always are using rhythm of some kind, either in the way that they're breathing or in the way that they're moving their body. Maybe they're counting, maybe they're using music, maybe it's an external rhythm, maybe it's all internal, maybe it's some sort of mantra or verbal affirmation they're using. So rhythm is something that we can use to our advantage. The second one is relaxation. So the goal of almost everything we do to cope with stress or pain and labor is designed to relax the mind and body. We know that fear, tension, and pain work together in a vicious cycle to bring more tension, fear, and pain. And we want to disrupt that cycle by calming our mind, by relaxing our body, which actually eases the tension that we feel and then diminishes the pain and the fear that we feel. We want to interrupt that cycle. So when we relax our bodies, we also increase the flow of oxytocin and endorphins, which are the natural substances that our brain emits that allow our labor to move forward and allow us to cope naturally with our labor. So we want to maximize our endorphins and our oxytocin release. All right, the third R is ritual. So at some point, we see people in labor finding their way again and again into some behavior that helps them cope. And when they do, when they find that thing, they tend to repeat it over and over and over. I've seen women who needed to stand and sway, leaning on their partner for each contraction over and over. I've performed something called counter pressure on someone's sacrum over and over, and they needed it every single time for quite a while. And then as the labor shifted, something else became apparent. Maybe your ritual is going to be shouting the F word at the top of your lungs. I don't know what your ritual is going to be. You don't know what your ritual is going to be. Maybe it's going to be one of the things we practice here today, and maybe it's going to be something spontaneous that comes up for you. So I encourage you to, in your labor, pay attention to the things that help you and keep doing them. Partners, if you notice that she's doing a particular thing that's really helping, acknowledge that, remind her of that, help her with it, help her continue it. Maybe you even mimic it and do it with her. All right. For me, I'll just give you an example. For me, in my second labor, one thing I really needed to do over and over and over, I don't know why, but I was lying next to my partner in bed and I needed to take his hand and stroke my thigh rhythmically with each contraction while I rested in between the contractions and then breathed my way through. And we probably did that for over an hour. I never practiced that. I never planned it, but it just happened and it really, really helped me. When you get to the point that you've lost your way, when you get to the point that it is so difficult that you don't know what to do, partners, you can really help in this moment. You can help by finding eye contact. You can say, I'm here, I'm with you, let's get through this together. Let's breathe. 1, 2. You can move and conduct with her. You can breathe with her. You can count one of those things, all of those things. Just knowing that somebody's there and you're going to get through it together, and then make a plan in between that contraction and the next one to see what can help the next time. If you feel like you're panicking, say something. If you feel like you're out of control, say something. And partners, this is something that you can do to step in. All right, we are going to jump into the techniques now, and we're actually going to start just by working on some breathing. So this is very basic. This is something that is a foundation of coping in life and something that we talk about for labor all the time. These breathing techniques are not a magic wand. You're going to probably need some other techniques, but this is just that foundation, that layer at the very base of how we cope with labor that should help you through a lot of your contractions. So the number one breathing technique we're going to practice is just a slow breath. It's just a deep inhale and a deep exhale. So go ahead and practice that with me. Let's breathe in through our nose, out through your mouth or your nose, whatever's more comfortable. Again. Exhale. Let's do a few more cycles of this. And especially with your exhale, I want you to really think about letting tension go from every area of your body. Maybe think about your jaw opening and relaxing. Think about your shoulders dropping. Think about your legs unclenching. Your toes are uncurling. We can really use that exhale to let go of all that tension in our body. So let's practice that together. Find a comfortable seat. All right, let's inhale. Exhale and let your jaw hang open. Inhale. Let your shoulders drop as you exhale. Inhale again. Maybe let your neck just roll, your head roll around on your neck to let go of some tension in your neck. Deep inhale, one more exhale, and just let it go with a sigh. So a few of those slow breaths will probably be able to get you through some of those early labor contractions. As things get a little more intense, you can do something called light breathing. So it's not necessarily just quick breathing, it actually is a lighter breath. You're not trying to fill up your lungs quite as much. If you try to quickly inhale and exhale the same amount as we do with our slow breath, you can actually lose oxygen and hyperventilate. So we don't want to do that. We just want to do this more shallow, quick breath. It looks like this. Try it with me. Good. Partners, turn to each other. I want you to conduct each other as you practice this. So using your hand, using your body in some way, make eye contact, look at each other, practice this light breath and see if you can get in the same rhythm together. Ready? 3, 2, 1. Good. Excellent. So that light breathing can be particularly helpful as things get more intense, or maybe just at the peak of a contraction. So sometimes you have a contraction that builds and you'll feel this really strong peak for maybe 5 to 10 seconds, and then it starts to come off that peak and get easier and easier. So sometimes we just need this extra light breathing just at the very top, that peak of the contraction. Then you can slow it down as you come down. You can think of the contraction as being a little bit like a wave, having a peak and then a valley. So you may want to experiment with different kinds of breathing for different parts of that contraction. So the other ways that we can use our breath, this is going to feel really stupid, but hopefully you're just in the comfort of your home. And I'm going to do this too, and I know I look stupid doing it. Thankfully, I was a voice teacher for lots of years before I became a birth worker, so I am very comfortable with this technique. So using our lips to completely let go of our jaw, and we're making a sound like a horse, and it looks like this. You can't possibly do that and maintain any tension in your jaw and mouth. So try with me. Don't look at each other. Everyone looks stupid when they do this. I don't care if you see me. The whole internet can see me doing this now. So there you go. I look as stupid as you do. So ready? Okay. Do that a couple more times to get used to it. If that's impossible for you, you can also do something like this. You can say, ha ba 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 ba. That's as useful. So just focusing on bringing lots of space in between your molars, letting your jaw just hang loose, letting the muscles of your lips and your cheeks just get really lax. So try that with me. Ha ba 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 ba. Good. That can be really helpful as well. All right. Before we move forward, I want to practice some slow breathing again, but with something called an active relaxation or a body scan. So I'm just going to, as you breathe, talk you through thinking about each part of your body and dynamically allowing it to relax and allowing tension to fall away. All right, so find a comfortable seat and allow your eyes to close if you don't mind. Start your slow breathing in through your nose, out through your mouth. Once more. You can sigh as you exhale. Do you keep breathing like that while I talk you through this body scan? So just think about the very top of your head. You're actually going to grow towards the ceiling. Find some height in your spine. And then you're going to let the muscles of your forehead relax. Let your eyebrows droop. Let your cheeks relax and let your jaw fall open. You can feel like there's a grape or a marble in between your back teeth, just finding that space in there. And as you inhale and exhale, find some openness in your throat. Really feel that oxygen flowing in and out through your throat, through your trachea. Put a hand on each of your shoulders. And as you inhale, Let your shoulders climb towards your ears, and as you exhale, let them melt towards the earth, and replace your hands on your legs. Wiggle your elbows just slightly to bring some motion into your arms. Tap your fingers on your legs or on your couch or wherever you're sitting, and then let them find stillness. Feel your belly rise and fall. And feel your bottom where you sit. Roll your ankles one way and then the next. Wiggle your toes and then find stillness. After your next exhale, allow your eyes to open, and you can return to me. All right, you should feel very relaxed. That was quite a long body scan or guided relaxation. You can use a very miniature version of that, maybe in between a contraction or during your very earliest contractions. Partners, this is a great thing to talk her through. You don't even have to say anything. You could just touch the top of the head. In between the eyebrows, we often hold a lot of tension here, so I find myself as a doula just gently rubbing in between the eyebrows to get rid of that furrow we get when we're in pain or concerned. You can just draw a line down her jaw, touch your shoulders gently. Nice hand massage can be really nice here to help release tension there as well. So just some ideas to help the body relax, especially in between contractions. So we want to be relaxed certainly during the contractions, but if you can completely let go in between, then you won't carry that tension into the next contraction, if that makes sense. All right, so that's our breathing techniques. You can mix and match. You can do whatever you need to do. You can pant, you can say things, you can chant, you can shout, you can... Actually, that reminds me of one more thing I really needed to talk to you about, which is using your voice in labor. It is really, really common for people to moan, to chant, to shout, to groan, to use your voice, especially as things get very intense. And I want to encourage you to get loud, to use your voice, and to especially turn those sounds into low, resonant kinds of sounds, like a ha or a oh, things like that. Those kinds of low resonant sounds can be really helpful to just vibrate the body, to relax, to allow that jaw to open. The higher up we get with our sounds, when it sounds more like you're panicked and in pain, you feel panicked and in pain, and then your whole body starts to climb upwards when we want to be going down towards the earth. We want to be dropping and relaxing. We want to be grounding ourselves. So let's try to let those sounds drop. Let those sounds really resonate in your chest, and you'll be on your way. All right. So positions. We're going to start talking about how we're going to use our body, and I want to give you two different concepts of what we're going to be using our body for. So one is movement. We want to keep the body very dynamic. If we're still through our whole labor, then our baby doesn't have quite as much of an opportunity to rotate and come down and to use the motions that your baby wants to be able to come down and corkscrew right out of your pelvis. I've got my pelvis and my baby here, so I'll show you real quick. So most babies come in. Let me get my pelvis turned the right way here. So this is the front, the pubic bone, the sacrum, the two hip bones. We've got here, most babies come into the pelvis with their back to your belly, facing your back, usually a little bit to the side, one side or the other. And babies know to do this. They know to tuck their chin to give you the smallest part of their head, which molds perfectly through. And they know to turn to fit exactly the right way. And the more that we move, that we sway, that we allow our hips to flex and our pelvis to open the way it's designed to do. By the way, there's room for movement in your pelvis. Your pelvis can open even about an inch to be able to accommodate baby coming through. My bony pelvis, it needs some help, but we've got some opening there. And that's normal and natural and part of the process. So the more that we can stay moving and dynamic, that you can dance and sway, the more opportunity we give for your body to help accommodate that space for baby to move down and through. And then the other thing we want to think about is using gravity. So that doesn't mean being on your feet for your whole labor. That's going to be exhausting. If this is your first baby, you may be doing this for hours or days and want you to hear that. Probably not the very active labor part of things, but we know that especially early labor and our first birth can take quite a while, even days. So be prepared for that. And definitely use rest. We want to rest as much as we can, but when you're able to, when you feel like you have the energy, using gravity is a very good thing to do because babies are coming down. You want to use gravity, not be working against gravity. We don't want to birth our babies uphill. That makes it very difficult. But we can use a lot of positions that are still gravity positive and using gravity that aren't just standing on your feet the whole time. So we'll be talking through that a lot. Oops, there go my notes. A little note, generally the closer someone is to giving birth, the closer to the floor they get. It's really interesting to watch. You might find that in the beginning you start being able to do a lot of standing and swaying. It might feel good to squat or to lean against something or lean against your partner. And then it starts to get a little more active, and maybe you're somebody who can continue walking through that and dancing through that, or maybe you'll be like most of the people I see who need to maybe get closer to their hands and knees, closer to the floor, maybe doing some side lying and things like that. And then to the birthing time when you start to push, I see a lot of people doing this in hands and knees or laying on their side. Every now and then somebody really feels good standing up and wants to birth that way, and that's a great thing to do too. It's a good conversation to have with your provider, what kind of positions they're comfortable with you, comfortable catching your baby in. So some providers are really able to catch in whatever position you want to birth your baby in, and some providers have some opinions about that and what they are most comfortable with to be able to protect you and your baby. So that's a great question to ask them. So you don't have a surprise at the very end when you're not, if you and your provider aren't aligned in how you want to be physically when you're giving birth. And we'll talk a little bit more about the pushing stage and positions later, but essentially, let's just get into it. So I need my partner. All right, so let's get going with some of our techniques and positions. I want to encourage you during this section of our course to go ahead and start and stop the video as much as you need to be able to perfect these positions and these techniques. We're going to go through them pretty quickly. I'll give you the basics and we'll show them to you, but it's up to you to fine-tune them and to feel like you've gathered some confidence to be able to use them. So I'm going to invite my husband and my actual birth partner in real life, Nate, to come on in, and we're going to show you some, that probably cut off my head when I stood up, some of our standing up positions first. So, hi honey.
Hi.
We're going to do a slow dance, all right?
Right.
So a slow dance position is used to maintain an upright position, to be able to use movement to bring movement to the pelvis, and also to be able to have something to lean on. It's really nice because you also get to be really close. Your partner has the ability to rub your back or squeeze your hips during this position, so it can be really, really nice to use this position throughout your labor. Next so go ahead and pause, work on that, fine tune it, see what feels good. I like to kind of stick my bum way out, bend my knees a little bit, and really lean in to be able to maximize holding on to him. And partners, stay nice and strong so that you're not bending over and using your back too much. All right, and we're going to practice some supported squats now. So the first one is going to be, I'm just going to hold on to his arms a little bit. You're going to kind of grip my forearms as I descend into a nice squat, which you can't see because I have this bench here. So I'm going to move my bench. We'll try that again. So I'm coming down into a nice squatted position. Can you grip my elbows a little more? There we go. So I'm probably only using about, I'm only holding up about half my weight, and he's holding up the rest, so I can get this nice openness. I feel a good stretch in my in my spine, and there's lots of room for my baby to move down. And was that too hard for you? No, because you're really strong. All right, so that's one supported squat. The other supported squat that we're gonna show you, Nate, go ahead and sit in the chair. And I'm going to, if you open your knees a little bit, I'm gonna come into a squat a little more, using his knees as kind of a holder in this nice squat position. My bum can touch the floor if I want it to, just to maintain this nice open position. A squat is really effective to open and relax the pelvic floor and allow those femurs to rotate open a little bit to provide more room for the baby to come through. And while I'm here, if he feels so compelled, he could rub my shoulders, he could encourage me and rub my hair and things like that. See, he's really good at this. All right, so that's, and then to help me out, can you pull up on my hands a little bit? There we go. All right, so those are the two supported squats that we're going to talk through, or that we did talk through. All right, we are going to now, I don't need you for a few minutes. Bye. Okay, we're going to talk about some forward leaning positions. So look around your house right now and try to spot some things where you could lean against when you're walking around. Maybe it's your counter, maybe it's your sink, maybe it's your table. I don't have anything right in this space, so I'm just gonna imagine that I have a counter here. I'm gonna lean against here. I'm going to sway back and forth. I've got gravity working for me. I'm in this forward leaning position. So if I'm not pregnant, but if I were pregnant, my baby would have this nice hammock in my belly. My back would be getting a lot of release here from, you're working really hard to hold your baby up and in. So the more during a contraction that we can just let everything relax and let go, especially in the front, and allow everything to move, we've actually given baby a chance to come into the best position with their back to your belly to be able to come through the pelvis. So I find I and a lot of the people that I support in labor end up spending a lot of time just walking, especially in between contractions, and then, a contraction's coming. I'm gonna find something to lean against, sway through it, breathe through it. I've got that forward leaning position. I'm not working so hard, and that can feel really, really nice. So right now, take some time, experiment with all the different heights of things in your house, pause the video, and then come back and start it when you're ready to move on. All right, the next thing that I want to show you is using your ball if you've got one. So I'm going to move my chair, get my ball. This ball's actually a little bit small for me. If you are a taller person, like 5'7" or above, you may want to think about getting a 65 centimeter ball. If you're a little bit shorter, and I'm sort of in between at 5'6", a 55 centimeter ball, which is what this is here, might be right for you. Essentially, you don't want to be so low that your knees are very much above your hips. They should be pretty even. And you want it pretty blown up until it's pretty firm. So using your ball actually puts your body and your back in such an excellent position. You should be using this prenatally as well. We've got that nice open curve in your lower lumbar spine, and that allows you to sit in very good posture. If I open my knees, it actually lets my baby and my belly hang a little bit forward and use gravity in that positive way that we're used to. So if I've got my knees nice and open, I can move back and forth. It should just feel really nice and open and loose and limber in your pelvis. This is excellent for toning the pelvic floor. If you're going to do this prenatally, you could even sit on a ball while you're watching TV or while you're working at your desk. That would be excellent. So in labor, you might find yourself sitting on the ball, and then during a contraction, use some sort of repetitive movements and just sit and relax and breathe through your contractions. You may find that at some point sitting becomes a little much with the pressure as baby descends further and further into your pelvis. That the pressure against your perineum may just be too much, and you may find yourself needing to be more on your hands and knees or something like that. So let's practice a hands and knees position now. I really like using a ball for this, but people do all sorts of things. You can just go on your hands and knees on your carpet or on your mat. Or you can lean against the front of your couch or use a ball like this. So whatever you do, see as if you can get into as relaxed a position as possible. So right here, I'm trying to kind of get my sternum in contact with the ball to leave lots of room for my imaginary baby belly. I'm pretending I'm 38 weeks pregnant right now. I've got a straight line going from my knee to my hip. You can't see it, but my hips are nice and open here. And I'm just going to use this ball to maintain some dynamic motion. I can move forward and back as I breathe. I can go side to side. In a moment, I'll invite my partner back to incorporate some hands-on techniques with this position. It's a great position for hands-on techniques because the pelvis and the back are so available for pressure and for massage. So this is really nice. I personally find myself in this position a lot when I'm laboring, and I see a lot of people choosing naturally just to labor in that kind of position. It can feel really nice. So go ahead and spring for that birth ball if you haven't already. Stick this into the side for the moment. Let's talk about lunging. So there's a lot of reasons we might bring a more asymmetrical opening or movement to our body. One of which would be if labor is going on a really long time. Another would be if you're experiencing back labor. So back labor is this really scary term for when we have a lot of sensation in our back, which might just be because of a particular person's physiology and the way they're shaped, or it could be having to do with the position of baby as they're coming through. So babies who we talked about, babies coming through typically in the anterior position, back to your belly. Sometimes babies want to come through in this position that is belly to belly, sunny side up, or occiput posterior, so the head coming in that posterior position instead of anterior. When we do this, the back of baby's head, the boniest part of baby's head, is sitting right on that sacrum bone, which can just bring a lot of sensation, and it's not always a pleasant sensation. So let's show you the lunges. What you're gonna want is a sturdy chair, not a chair like this. This is what you get when you move and you haven't bought dining chairs yet. So use a much sturdier chair than this, but I can show you the mechanism. So your planted foot on the floor is facing straight on, and then you're gonna open with your foot that goes up about a 45-degree angle, ideally holding on a little bit higher than this, but I'll hold on here. And then throughout your contraction, you're moving in and out, slowly and gently, of this lunge position. You can also accomplish this on stairs if you like skip a stair or two, depending on how long your legs are. I love having people walk up and down the stairs sideways, holding onto the rail, and then stop through a contraction and bend like this into the lunge. And then of course anything you do on one side you want to also do on the other to provide symmetry. So we'll go ahead and switch to the other side carefully on my folding chair. So go ahead and practice those on your own dining furniture, and pause until you feel like you have it figured out. Partners, you may stand in front to give them something to hold on to. You could stand behind to give a little bit of a support, because it can feel a little unsettling to be unbalanced like this when you're pregnant. All right. Something else that you have in your home that you really should be taking full advantage of is your toilet. So your toilet is the place in your home where you are trained since you're about 2 years old to release, and we want that release in birth. That is a good thing in birth. We want those muscles to let go, to let your baby pass through. So hopefully you're hydrating to the point that you are needing to use the restroom every hour or so, 2 at the most, and you're spending some time on the toilet already. I know the contractions will feel intense. They often feel very intense because of that release, actually. And often they're very productive contractions when you're sitting on the toilet. So don't be afraid of them. That productivity is really, really good. That intensity is really, really good. Don't forget that that intensity is what's bringing your baby. You want those big, hard contractions to bring your baby down and out, okay? So don't be afraid of those. You'll probably want a little extra support and encouragement when you're on the toilet. So Obviously just the normal toilet sitting position. But here's my trick I'm going to give you. If you have the kind of toilet that has the tank on the back, clean your toilet well and put a pillow on it, and then straddle your toilet backwards, lean over the tank, and here you have an amazing restful position with that nice openness you're going to get that your body automatically gives you when you're on the job. All right? But you didn't think I was going there today, huh? Okay, and lastly I want to show you a really good, still gravity positive resting position. It is so appropriate to rest during your labor. During early labor, of course, whenever you can, through the night. I hope you can stay in bed until the contractions are too uncomfortable to handle on the bed. And even then, try to find a way to rest, if not during, then in between contractions. So this is a really good way to do it, probably very similar to the way you are already sleeping at night. So I'm going to put a pillow for my head, 1 or 2 or more pillows for between my knees. I'm going to get onto my side, right or left side, it doesn't matter. So I'm all aligned, and now I'm going to bring my knee up as high as I can get it, and I'm going to roll over onto my, really almost onto my belly. If I were pregnant, I could probably get to about here before I felt like I had to stop. And then you might even want another pillow here. This can really use 4 or 5 pillows if you're doing it right. So my hips are going to be really wide open. I've got my knee way up high. We're giving this really awesome asymmetry and also this gravity forward, gravity positive position. And here I can really just settle in and rest. Obviously I would probably want another pillow here to rest my knee on, but really, really good position to labor in. It's awesome. And of course, if you're doing it on one side, every now and then flip to the other side as well. Okay, with all these positions, I want to give you this bottom line. The bottom line is, unless you have a reason to need to change your labor at all, to make it speed up, to try to get contractions that have been asymmetrical or irregular to kind of get more regular, unless you have something like that going on, essentially what you're just trying to do is stay as comfortable as you can and stay as calm as you can. So use whatever position feels good to you, okay? That's it. If you really like standing and swaying, do that for your whole labor. If you're feeling like you're handling them the best, just laying on the bed or leaning over the ball or whatever it is, please do that. Do that until it doesn't work for you anymore. And then change to something else. Partners, this is really where you come in. She says, I really can't kneel anymore, I really can't stand up anymore. You say, okay, let's try that hands and knees position. Maybe let's walk the stairs. Offer her a couple of options and let her choose from there. So you really, there's really no formula. You can go through your whole labor without doing any of these suggested positions as long as you are coping, okay? So use these tools to your advantage. Okay, so let's talk through some hands-on techniques. I'm going to invite my partner Nate back in the room, and remember those hip squeezes that I really like during labor, so let's go ahead and do those. So when you do a double hip squeeze, essentially what you're trying to do is move the top of the hips, the iliac crest, just slightly towards each other, and to free up some of these ligaments and the fascia that all connect in the sacrum area. Allow them just to relax a little bit and open that hip, that pelvis a little bit. So I'll let Nate try, and then I'll talk him through fine-tuning it. So he's gonna put his hands on my bum, up a little higher, honey, there, okay? And his elbows are out, and he's just gonna squeeze together in kind of that area, that muscular area in between. It's not quite my hip bone, it's not quite my sits bone, in this really meaty gluteus maximus area right there, and that should feel really, really nice. So go ahead and pause and try to work on that. If it doesn't feel good, it's probably not the right spot. So think about, don't pause it yet, I'm gonna keep talking. It's a little bit, sorry honey, it's a little bit in, and then it's a little bit up too. It's a little bit of a J that you're drawing with your hand. So try that again, huh? That's it. Thank you, dear. All right, so pause and work on that, and then come back to us. I need you still, because now we're going to do sacral counter pressure. All right, so I'm going to get back in that hands and knees position again, and Nate is basically he's going to find, come on down again, that nice flat part of my sacrum and just push into it with his palm. On me, it's right about here. He's just going to push straight down to the floor. That's it. That feels great. This can be especially helpful if you're having that back pain. I had a client once who called it her magic button. She needed somebody to press it for every single contraction, or else she had really terrible back pain with each contraction. Basically what we're doing is, if baby's head is putting pressure on the inside of the sacrum, we're just pushing against it to kind of equalize that pressure a little bit, which can take a lot of pressure off those nerves. So practice that push. Great, thanks. You can ease up on the pressure, and I'm just gonna show some very basic massage techniques now. So you know probably how to give a decent back rub, I would hope. But other ways we can use our hands are two things: firm pressure and light pressure. So firm pressure might look like really pushing down on the shoulders. That can feel really nice to try to ground someone a little bit and just help them feel safe and secure. We might give a shoulder rub, or help a certain part of the body relax and ease the tension through some more firm massage type grip. Or we could use light touch. Light touch might look like gently touching between the eyebrows to tell someone to relax and not furrow their brow there. Maybe it's gently touching the jawline to remind them to loosen the jaw. It might look like a gentle hand massage. So circular motions on the palm with the thumb can feel really nice, the two thumbs. Gently working out the fingers from the palm to the fingertip can feel really good too. Or if I come behind you, actually that works, that's great. Light, gentle touch along the spine, like your fingers are barely there. Down along the arms and the shoulders can feel really nice to someone in labor, especially in between contractions. All right, can you go on hands and knees again? So we're going to use something like a scarf or a light blanket or a very light towel. Any piece of textile that's longer than it is wide would be great. This is just a scarf. So this is a kind of a technique that comes from Mexico, and traditionally we would use a piece of textile called a rebozo, but we're not doing that today. We're using kind of borrowed techniques, and I would encourage you to go try to learn more about rebozo techniques if this is something you're interested in. But we're going to do two simple things today. One is just a lift on the belly. So I basically hammocked the belly. I need to stretch this out a little bit more. It should go from about sternum to pubic bone, covering the whole belly. I'm hammocking all around here, around our pretend baby. And I'm just gonna lift. If there was a baby here, I'd be imagining I'm lifting this baby just a couple centimeters, letting that belly let go and relax a little bit, not having to do so much work, and aligning that baby with the birth canal a little bit, letting these back muscles not work so hard. How does that feel?
Great.
Awesome. And I'm not just going to let go of this, because that can be a shock to the system and those ligaments and muscles. So I'm going to gently give you your baby back. And I'm going to gather it again and lift up a little bit. By the way, I'm holding my body pretty steady. I'm very close into his bum. And I am going to be using mostly my lower body to do these techniques, not so much my upper body. If I'm doing this for a long time, I'm not going to be able to sustain that kind of support. So I'm going to lift a little bit again, and I'm going to just, from the wrist, gently jiggle. And I'm jiggling. Your tummy doesn't really jiggle, honey. I'm gently jiggling that baby, that abdomen, and all the ligaments and muscles there, and the fascia. So we're actually telling the fascia, the connective tissue in the belly, just to let go just a little bit. I'm doing this for a minute or two in labor, but in between contractions or prenatally is a really great way to relax the muscles, relax the uterus, give baby some space to be able to turn if they need to. Really, really good way to help labor along and relax the body. All right, I'm going to stop and give you your baby back. And thank you, Nate, for your help. Let's give him a round of applause. We're in the COVID-19 quarantine time, so I don't have a pregnant model to work with, so thanks, Nate, for pretending with me. One more thing I'm gonna suggest to you is something called an abdominal lift. So without the rebozo, we can do this standing up. We might do this if labor is going on a long time, if we have contractions that are very irregular, if it's very painful or something like that. So similar to going upstairs at an angle or doing those lunges, where these are some techniques we might use if labor is not going more according to plan. So have this in your back pocket if necessary. So essentially, I'm going to tuck my pelvis so that the curve of my lower back disappears a little bit, and I'm going to go under my belly, and I'm going to lift up, and I'm going to lift in, just a little bit. So in labor, this can be a little more firm. We're essentially gathering baby and bringing baby a little bit closer to the spine, lining baby up with that birth canal a little bit better. Maybe putting some better pressure of that head on that cervix to try to encourage dilation and opening. That can be really helpful. So I can do it just standing. I can do this against the wall. Tuck my pelvis, feel that wall with my lower back, and then lift up and in. And I would hold through a contraction. And I would do that 10 times in a row through contractions, just holding my baby. The other way is if you lean against your partner's chest, they can reach around and actually help you do that abdominal lift themselves. All right. I'm going to get my bench back because that's what I have for positions and hands-on comfort today. I just wanted to give a quick note about something that we call holding space. So holding space is this idea that we can be in the same room as somebody who is going through something difficult, that we can be with them, that we can be for them, but we don't have the ability to change it or to fix it for them. And we don't need to be constantly doing something to try to make it easier. Sometimes just being there for them, breathing with them, thinking really good thoughts for them, paying really good attention. Sometimes that's the most powerful support there is. So partners, if you're feeling like you don't know what to do, if you're feeling like you've run out of ideas, don't underestimate the power of just being there with them in that moment. All right, so that's all for positions and hands-on techniques. If you want to get comfortable again, then I'll be back with you in a second. All right, now that we're back, let's talk about some other kinds of comfort measures that don't have to do so much with that hands-on support or positions particularly. So ways to stay nice and comfortable in labor: keep yourself hydrated. So we're going to keep drinking, we're going to keep peeing. You don't have to drink, but about a glass or a small bottle every hour or two would be appropriate. We drink to thirst. We want to keep your that big muscle of the uterus nice and hydrated so it can work optimally. And the same with nourishment. So we talked a little bit about staying away from being hungry. So eating to, not because you're going to be very hungry in labor, but because you need that energy for your body to be able to keep going. So really good foods would be things like cereal, oatmeal, smoothies, fruit, crackers, something that's easy to digest, easy to snack on quite quickly. Sky's the limit. Get creative. Have lots of things on hand because you'll never know what you're going to crave. But we try to stay away from things that are usually too spicy or really fatty or harder to digest. It's also fairly common to become nauseated and to vomit in labor. So little trick is don't eat anything that you don't want to experience again on the way up. So we talked a little bit about oxytocin and endorphins. The environment that we create in your labor can really have a great effect on how well your labor physiology can function. So keeping things private, dark, quiet, really comfortable, keeping your partner close if that's something that you want, or having loving touch from mother, sister, friend, somebody who you really feel close with. Those are really good things. Trying to limit the number of strangers who just walk into your space can be a really good thing to prevent that fight or flight or freeze kind of response that we get, those catecholamines and adrenaline types of neural stimulus or neural response. We want to avoid that. We want to keep you in that really good, peaceful flow where your oxytocin and your endorphins really thrive. And if you're taking my full course, I have a whole module that you will have experienced already about all the hormones of labor. So we're just trying to make an environment where you feel really comfortable and safe. That can be at home, that can be in your hospital room. There's tons of ways to make your hospital room feel very safe and secure, from dimming the lights, bringing your own lights, putting up a tapestry, bringing in your own bedding, things like that. I've known people who brought houseplants and a diffuser for essential oils and their own, had their favorite TV shows playing. So sky's the limit in terms of making that space your own. And then you could think about, putting in your birth plan to limit the number of strangers and new people that walk in, trying to keep your nurse and your provider and the people that come in really consistent if possible, except for shift changes, of course. That can be really good. And then also thinking about, if you are going from home to hospital, what that transfer looks like, how you might stay really in your labor land zone so that you can keep really coping very well, stay in your little bubble. Some people decide to put their hood up and put some headphones in with some music they love. That can be a really good way to do that. And partners, this is a good opportunity for you to field questions and to kind of be that point person. So the person giving birth doesn't have to kind of come out of that really instinctive labor zone into that more prefrontal cortex thinking mentality where they're having to make decisions and ask questions and answer questions. That's actually not conducive to the labor process, which is very automatic and very intuitive and innate. So we want to protect her ability to really stay in that zone as much as possible. If we think about the way that gorillas give birth, essentially the male stands at the mouth of the cave or guards their space while the female goes and does her thing. And so you can think of yourself, partners, as being that gatekeeper for the person giving birth, to be able to allow her to just thrive and continue to stay in the zone, to feel really, really secure and supported, so that we don't have to have her come out of that flow. All right. Rest and sleep we talked a little bit about, but it's so important to try to really stay as energetic as you can, and it's taxing. It's an endurance thing. So especially early on, try to take that opportunity to rest and sleep when you can, even if it's in between contractions. It's really appropriate to sleep and stay in bed for as long as you possibly can while still coping. There's really strong evidence, and a lot of people use water in their birth. So whether that's standing in the shower for hours and hours, which you can do at home or in the hospital, or if it's using your tub. So especially once things get really more into that active labor stage, we're really going to it can be very, very helpful to immerse yourself in warm water. There's strong evidence to support that for a labor pain relief technique. And if water birth is an option to you and something that you're interested in, I encourage you to explore that possibility, because then you can use that pain relief tool all the way through to the birth of your baby. It can be really, really good. Some people do also use a technique called hypnosis or self-hypnosis in labor. There's hypnobabies and hypnobirthing and lots of different techniques out there that you can take a class in or access videos online if that deep self-relaxation with kind of mental cues sounds like something that could be helpful for you. I've seen it work very well for people to get them into that space where they can really cope with each contraction and stay very calm and relaxed. So that can be really nice. Okay, let's talk a little bit about back labor and a little bit We covered the back labor techniques I wanted to talk about, except that I also didn't mention ice and heat. Those can be very effective tools. Applying, an ice pack or heat low on the belly or on the back wherever it hurts. Those can be really good. Some people who have a lot of back pain find that ice can be very, very helpful, and you can even get something like a juice can or a soda can and roll it along the back. That can feel really good and be pain relieving as well. I also wanted to mention one more, if you are experiencing that back labor, one more position, which would be on your hands and knees, but putting your chest way down on the floor onto a pillow so that you've really got your bum up in the air in sort of an inverted shape. That can allow baby to come down just slightly out of the pelvis and maybe wiggle their head a little bit, or potentially just take that pressure off of your sacrum, which could be causing your back pain. So a lot of people find that position to be very effective for them if they're experiencing a lot of back labor. I also wanted to talk about, if you do decide to have an epidural in labor, it's an incredibly good pain relief tool if that's something you're wanting to use. And there's really good ways to stay active and to actually keep moving around, and to partners for you or for support people to keep offering support once the epidural is in place. So movement can be really great. So turning side to side, or you could even think about doing something that we call the epidural rollover, where you're going to go on one side supported with pillows, and then maybe up on hands and knees if that's available to you, very supported all around you with pillows, to the other side, and then more on your back, and then back in this supported, leaned back but sort of semi-reclined position, with the hospital bed up a little bit, some pillows here, and then just keep, every 30 or 45 minutes, keep rotating, keep turning, get your knee way up by your armpit. Try that really rolled over position that we tried. Just because you're having an epidural doesn't mean that you aren't an active participant in your birth, and that you aren't able to use your body and use gravity to help bring baby down into a really good position. I've seen people even give birth on hands and knees, and to spend significant time squatting, even with an epidural. So that squat bar that's available for the end of the hospital bed, if you're birthing in the hospital, can still be available to you, depending on how much mobility you have in your legs. So that's a good thing to think about when you're getting your epidural placed, asking for the lightest dose possible. And anesthesiologists don't always have control over the amount of numbness you feel. They just give you a dose and it works in your body the way that it works. But you can talk to them about that option if that is something that's interesting to you. When you have an epidural, you might suddenly feel like something's being done to you instead of you being an active participant. So it can feel it can be a difficult thing to go from all of a sudden being so active in your labor to just being there on the bed. So partners and support people, it's important to keep encouraging that person to keep that hands-on support if she needs it. A lot of times people really need a lot of help moving around. They might feel itchy or get cold or warm or things like that. So just attending to her needs in that space as well. And once you have the epidural, this is the time to take a nap, everybody. So try to conk out for as long as you can. Especially if it's been a really long road, partners, you should take a nap as well, so you're really rested. And that's a great thing to do once you have an epidural. So epidural births can be really, really beautiful as well, just the same as unmedicated births. Just the support changes a little bit. So yep, that's it. So let's go ahead and take a break and grab your ice from your freezer. So 3 or 4 ice cubes each, and a towel and a bowl, and this is for each of you. And we'll be back to do that ice activity in just a second. Okay, so here we are with some ice, and you're probably thinking that I'm a little bit crazy. I'm not in any way suggesting that holding ice is any kind of simulation for the discomfort of labor. That's not what this is really for. What this activity is for is to teach you how to use some mental and physical techniques to cope with something uncomfortable. So we'll practice a few different things with this, and your hand will start to feel uncomfortable, and we'll see what we can do and what works the best for you to get through it. So get ready with an ice cube, and I'm going to press start, and you're just going to hold the ice cube in your hand. I have this for drips, and you're just going to squeeze it and try to get as much contact with that ice as you can, and it's going to be about a minute, and I'll tell you when you're done. All right, here we go. Okay, go ahead and return the ice to that bowl and dry your hand off. How was that for you? Was that pretty uncomfortable? I really don't like this. My hand feels really, really bad right now. All right, so think about how that felt for you, and maybe pause the video and talk about it with each other, and then we're gonna do it again. All right, so we're gonna do it again, and this time you're gonna take the ice in your other hand to give that hand a break, and this time all we're gonna do is think about our breathing, okay? We're gonna try that slow breath that we talked about at the very beginning of our class, okay? Here we go. Oops, stop. Inhale. Exhale. Just focus on your breath. Close your eyes if you want to. A few more breaths here. All right. How was that for you? A lot of people find that slow breathing to be very helpful, and maybe it was that for you. So pause for a moment if you want to talk about how that felt for you before we move on, all right? Okay. This time around, I'm not going to hold the ice with you. Pregnant people, you're going to be the only one holding the ice. Partners, this is your opportunity to try to improvise some support. Try to anticipate what she might want in this moment, whether that's telling a funny story or rubbing her shoulders or giving her a hug, looking into her eyes. Pregnant people, if you want to offer some suggestions, go ahead. Otherwise, find something that you think is going to work for you and grab your ice, and here we go. Go ahead and stop. Good job. How was that? How was that if you were the one receiving the support? How did that feel to be the person giving that support? Sometimes that can be a difficult role too. If you want to pause and talk about some other strategies, maybe pregnant people share what worked and what didn't for you. Partners share how that felt for you. And we'll do one more. Actually, we'll stop there. If you would like to keep practicing with this ice, that would be a great thing for you to do. Maybe stick it in the freezer and get it out again at the very end of the video. Or right now, if you want to try, here are some more ideas. So some people like to try using music, a song that you like for a minute, and see if that helps you. Some people use lemons or chocolate or something else that tastes good or interesting, or you could even smell it if you want to. Using those olfactory senses can be really effective for helping distract the mind from what's going on, from the more obvious sensations. So that can be an effective tool for helping lessen the sensation of the ice and therefore the pain of labor potentially. You may try offering touch or massage or that sort of thing, or standing and moving together. So lots of different things you could try if you want to give that a go in a little bit. But we won't spend any more time on that right now. All right, I am going to slide my bench away, and we are going to do a little bit of practice putting it all together right now. And essentially, we didn't talk about this much because this is part of the other modules of my course. If you're doing the whole course, we tend to think of labor as having some different segments and some different pieces. That early time that we've been talking about, where you may still be walking and talking through your contractions. They might be bothersome but not very painful, and really only coming every 8 to 15 minutes, something like that. And when they start to come more frequently, more like 5 minutes, lasting for a minute, feeling quite strong, we call that active labor or labor. In some circles, we just talk about that aspect being what we call labor. And then moving on to when we're almost fully dilated, we're almost ready to push that time where we're doing that last bit of dilation. Some people use the word transition to talk about that. So we're going to have kind of 3 flavors of contractions here. I'm going to demonstrate for you what it might look and sound like to see a woman in labor for each of those 3 times. And as I do that, I would encourage you to practice some of these techniques you've practiced today. So maybe that slow dance, standing and moving, or swaying, leaning on something for that early time. For the active time, you might try leaning over the ball or doing a supported squat, something like that. Partners, that's a really good time to offer support of some kind. And then for that last kind of transition contraction, we're really going to be, it's one of those really difficult ones. So you're just going to be holding on for dear life, honestly. So partners, you might need to be right in her face, offering very strong encouragement. Okay, so get ready. We're starting with early labor. Here we go. Okay, I think one's coming. Okay, good. Hey honey, can you get my water bottle ready for when I'm done with this one? Thanks. Yeah. Okay, come on, baby. It's almost over. Okay, stop the stopwatch. Alright, so that was about the length, maybe that was a little on the long side actually, of an early labor contraction. These would be spaced, 10 minutes apart, 20 minutes apart, somewhere in there. Not super strong, as you could see. So I wish I could know what you did to handle that and to cope through that in your labor rehearsal. All right, so I'm gonna get, I'm gonna lean over my chair for this one. This is more of an active labor contraction. So figure out how you're gonna rehearse this one. Partners, figure out how you might support. Pause if you need to talk about it. And here we go. Oh, it's coming, it's coming, it's coming, it's coming. Go a little bit long too. I guess I like being in labor. Okay. Now we're gonna practice one of these really rockin' and rollin' transition contractions. I'm gonna get in my resting position. If my partner were here, I'd likely have him right here in my face, like we talked about, counting with me, breathing with me, that sort of thing. So here we go. Get ready to practice. Oh, here it comes, here it comes, here it comes, here it comes. Oh. Oh. Man, I want to squeeze your hand. All right. I hope that rehearsal was helpful for you. If you want to stop right here and set your timer for 45 seconds, 1 minute, and then 1 minute 15 for those 3 kinds of contractions. Try it again. Try a few different things. Really use this time to see what you can come up with. Look around your house to see what kind of places you have that you would like to labor. Really think this through. This is a really good time to do this since you're sitting here watching this course anyway. And I'm going to grab my bench and talk to you just a little bit more. Okay. So I hope now that you've spent about 75 minutes with me that you feel like you have some really solid tools in your toolkit, some idea of how you might particularly, differently from the next person, cope with your labor once it starts. I want to reiterate for you that your labor will be really different from the next person's, from your friend who had a baby last month. And while you can't predict, and I can't predict what's coming for you, you can trust your innate wisdom as well as your good preparation for this event. I wish you a beautiful birth experience, whatever choices you find yourselves needing to make. please reach out to me if you need more support. I and my partner offer in-person doula support for birth and prenatally and for postpartum in the North Vancouver and Vancouver, British Columbia area. And we also offer virtual support for anyone in the world. So if that's something that you're interested in, please get in touch with us. My email will be on the end of this video. And please do go ahead and visit us at www.voyagebirth.com to download the handout that goes along with this course and see our other offerings and resources as well. Thank you so much for joining me today, and I hope you have a very beautiful birth.